I'm Marianne Dalzell. I'm a physiotherapist and past clinical director of the Rehabilitation and Exercise Oncology Program at Hope and Cope Siegel Cancer Centre in Montreal. The next question that I'd like to address is, if I have been diagnosed with bone metastasis, can I continue to exercise? Can I continue to maintain my present activity levels? And the answer to that is, by all means, yes. There is a great deal of research that has been done now on patients with advanced cancer with bone metastasis that has shown that if you stop doing the exercises or the activity levels that you have maintained to date as a result of the bone metastasis, your bones and your heart and your joints, everything, and your cancer will deteriorate more rapidly. So there is very, very good information on patients with advanced cancer with bone metastasis to show that survivorship increases, quality of life increases, maintenance of your functional activities, maintenance of all your activities is helped by maintaining your present level of activity, provided that, and there is a proviso, provided that that activity is not causing any pain. And the other provided that is that the activity is not causing undue stress on areas of bone that have been deteriorated by the metastasis. So that, yes, maintain activities, but it is activities that have to be guided. So a very good example would be if you know that you have bone metastasis in your hip. Any exercise that you might want to do should avoid undue stress and strain on the hip. And when I say stress and strain, the particular stresses and strains are undue weight bearing. So putting too much weight on one side of that hip that might be affected by metastasis. The other type of stress that might cause that bone metastasis to react would be any undue torque or rotation. So you don't want to stand on one leg and rotate your body on that pivot of your hip, because that would put undue stress on that particular hip. So that when you know the location of your metastasis, there are two things that need to be avoided, and that's undue loading, undue bending, and undue rotation. So there are three things that you have to be careful about, but it means nothing to the rest of your body. You can easily have metastasis in a hip and continue to do all the exercises you've done in the past with your upper limb, or with the other leg, or with your back and your abdominals. There's no reason why this one localized metastasis has to affect your overall quality of life and overall level of activities. It just means extra caution for the part that's affected. So important that if you do, and if you've been told that you have bone metastasis, that the first thing you do is find out where these metastases are located. Many patients never know. They are told they have metastasis. They don't wish to ask any further questions, but it's of great, great, great importance to you to know whether it's in your shoulder, in your elbow, in your hand, in your spine, in your foot. You need to know this for you to be able to protect those parts and maintain your activity levels with everything else. So again, the fact that you have bone metastasis does not mean that you shut off all activities. You just have to be more selective and know better how to be, in fact, seeking that guidance from a professional, either a physiotherapist specialized in oncology, or again an exercise physiologist or exercise specialist who has had experience in clinical oncology. Those are the people who should be guiding you in what to be done. Do not stop your activity levels.